Welcome everyone to today's webinar, Making Logistics Logical, a Guide for Surgery Centers. I am Emma Goodman with Becker's Healthcare. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Q&A and clicking send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it's my pleasure to start today's webinar by introducing our presenter. Marvella Thomas has 35 years of clinical experience in healthcare institutions. Much of her experience as a clinical leader includes management roles in surgical services, central, sterile, and administrative services at acute and ambulatory facilities. In her clinical management roles, she was responsible for department planning, organizational effectiveness, and staff development. She was also accountable for driving results that included fiscal and quality improvement activities. Major emphasis was placed on supply chain efficiency and inventory management. She has also managed through 2 new facility construction projects. Ms. Thomas joined Cardinal Health in 1998 as a clinical consultant with the pre-source division. In 2001, she assumed management responsibilities for the clinical and logistics team in the Central and Midwest region. Account activities have included supply chain, inventory, and equipment and instrument management for national and international accounts. She joined the strategic accounts team with Cardinal Health Ambulatory Division in 2015. Currently, as clinical manager, she leads a team that conducts operational assessments, focus on product utilization, process improvement, supply chain management, and space utilization. Ms. Thomas holds a Master's of Science degree in nursing and a Bachelor of Science degree in nursing from the University of Missouri in Kansas City. She has been a member of AORN since 1972 and has spoken at numerous local, national, and international meetings. Marvella, it's now my pleasure to turn the floor over to you.
Thanks for the introduction, Emma. I've been consulting for Cardinal for the past 20 years, primarily on the acute side. I moved to the non-acute or ambulatory side about 5 years ago. And at that time I thought, okay, this is going to be fine. I'll still be in the peri-op arena. The facilities will just be smaller. I don't think I was prepared for how small some of the facilities and their storage areas were. I also discovered a unique set of challenges that are quite different from the challenges on the acute side. So I hope this discussion will help with some of those challenges. So hello everyone and welcome. Let's start by covering our objectives for today. After this webinar, you'll be prepared to discuss how substantial supply spend is in ambulatory centers and surgical hospitals today. You'll understand 6 logistical challenges that impact efficiency and costs and how to address them, and we'll explore additional ways to improve efficiency and save money. But before we talk about each, I'd like to tell you a little bit about Cardinal Health's experience supporting ambulatory surgery centers and surgical hospitals. With more than 40 years of experience, Cardinal Health is a recognized leader with a top ranking for transforming the healthcare supply chain to meet new challenges around cost, revenues, and outcomes. Cardinal Health is a leading med-surg distributor for ambulatory facilities and surgical hospitals. Each of our perioperative nurses on our dedicated ambulatory clinical team has more than 20 years of OR and supply chain management experience. Our clinicians have walked in your shoes and they've seen the challenges that you face every day. More importantly, we can offer a fresh pair of eyes to help you meet those challenges. So now let's turn our attention to supply spend. How much is it and why is it so substantial? For each surgical suite, the average ambulatory center spends $230,000 on supplies, and they keep between $100,000 and $120,000 per suite of inventory on hand. The average inventory turn rate is just 4.8 times annually. So that means there are a lot of supplies that we only use once or twice a year, but we still need to keep them on hand. As a percentage of revenue, ambulatory center supply costs are substantial, ranging between 17 and 25%. And that's if you're performing well. And supply management takes a toll on your staff as well. 25% of clinical staff time can be spent on supply chain activities. That's 2 hours of every nurse's 8-hour day spent managing supplies. A staggering statistic from a recent study at the University of California, San Francisco, calculated waste in the OR at almost $1,000 per procedure at their medical center. So although this statistic is based on a study from an acute teaching facility, we should always consider waste when looking at the supply spend in your centers. And most importantly, staff members rarely receive the training and support in logistics and inventory management that's so critical to their roles. So let's take a look at 6 major logistical challenges and the actions you can take right now to address each. First of all, there are lease restrictions and rental costs to deal with. You may want or need more space, or you may want to make physical changes to the space you have, but you can't due to lease restrictions or the possibility of any changes increasing your monthly rent. So basically, the space you have is all you get. We're dealing with obsolescence of equipment and supplies. Practice and technology changes rapidly, so you might be storing old items that you'll likely never use again, yet they're taking up valuable space that could be put to better use. We have unit of measure and case quantity restrictions. Some distributors may require you to buy more than what you actually need. You'd like to order a box of 50, but you have to order a case of 200. That results in higher inventory carrying costs, higher inventory levels, and you're using more storage space than you need to. Delivery schedules and options are a challenge. Because ambulatory centers are not open 24/7, deliveries need to be made on time when your doors are open and when you have staff available to receive the supplies. And even then, getting to your door may be challenging. Manual processes for inventory and lack of data. We have poor visibility into actual product utilization, and this can drive up our costs and put products on the shelf at risk of expiration. And finally, we have multiple stocking locations. Having supplies gathered in several places is inefficient and takes time away from patient care. Tracking down supplies costs you and your staff time and money. So let's take a closer look at each of these challenges. As I just mentioned, you may want to rent more space or make physical changes to your existing space, but you can't due to lease restrictions or the possibility that these changes will increase your rent. And there just may not be any room to expand in your existing facility. For example, many of you don't have a dock or a receiving area, so your deliveries are made in a parking lot where they can be exposed to weather. And how many of you actually have receiving doors that are wide enough to accept a pallet? Or are you receiving supplies in public hallways? An issue I see frequently is an OR suite being used as a supply or equipment storage room. When activity increases, that room is needed for surgical procedures, but what are you going to do with the stuff you've been storing there? If you're thinking about making space modifications, ask yourself 2 questions. Number 1, based on your lease agreement, do you need approval to modify the existing structure? And 2, do you really need more space? Remember, that drives your costs up while potentially driving your profits down, particularly if you're using that space for non-revenue producing tasks such as storage. So let's try to maximize what we have first. So here's some steps you can take if you're running into barriers with your leasing agreement and physical constraints. Consider adding outside storage space if permitted or if you own your own property. Freestanding storage buildings are a good place to store bulk supplies and those supplies not needing a controlled environment. It could also be a good place for equipment that's used infrequently. I shared a conversation with a gentleman on a plane recently who worked for a global supply chain company. He told me about pickup drop-off lockers that are becoming extremely popular in the global market. It's a secure shed or locker where items can be dropped off even when your facility is closed. They come in various sizes according to what your typical delivery needs are. I thought this was a great idea for crowded parking lots that could benefit from after-hours deliveries. Plus, your supplies are there when you arrive in the morning. No more wondering when your truck's going to arrive. And if the lack of a receiving area is an issue, can you add a canopy over part of the parking lot or over your receiving door? Canopies or carport shelters can protect your deliveries from the weather. And always make sure you contact your leasing agent or building owner before making any of these changes. So now let's turn to the next logistical challenge, obsolete equipment and supplies. Are you paying rental storage for obsolete equipment? I visited a facility recently that was renting 2 off-site storage units. When we visited the units, we found stools and IV poles missing wheels, broken furniture, and partial cans of paint. So if you're renting outside storage space, make sure that you're storing appropriate items there and not just stuff you want to get out of the way. Is obsolete equipment taking up space on site as well? I frequently see microscopes, lasers, broken machines, and trays of instruments that are no longer needed. And doctors who no longer practice at your facility, are they leaving items behind? Or do you no longer support certain specialties, but you're still storing equipment and supplies for them? I was in one orthopedic center that had several shelves of laparoscopic supplies left over from an earlier era before they focused on ortho. Thousands of dollars of supplies that will eventually expire. So what can you do about it? Here's some potential solutions that work. Number one, just sell it. There are companies out there that purchase obsolete and broken equipment and instruments. They refurbish the items and then resell them. They'll also purchase unexpired supplies. You may be able to loan it. This is an option, especially if you're a part of a group and another group member can use those items. Donate it. There are organizations that can use donated materials for charitable programs. I've also donated supplies and equipment to our local zoo and animal shelter. Just make sure to check on any potential legal issues with product donations. And for a majority of items, just throw it away. As nurses, our genetic makeup includes the hoarding gene, and we sometimes have a problem throwing away anything, but if it needs to go, let it go. The important thing is to stop storing it. You're wasting both space and the money to rent that space. And we all know how valuable and critical space is in our ambulatory world. We all store way too many things at home and at work that we're never going to use again. So a lot of what I see simply needs to be thrown away. So next, let's discuss unit of measure and case quantity restrictions. Supplies are typically available in specific units of measure, requiring you to buy a minimum amount. This sometimes is not the quantity that you need, but that's what you're required to order. The result, you have a higher inventory carrying cost, and you're using more storage space than you need to. At home, I could buy a case of 100 rolls of toilet paper. It won't expire, and I'll eventually use it. But where am I going to store it until I do? One facility received 50 cases of urinals instead of 50 each. Instead of returning the items that they didn't need, they were struggling to find a place to store them. A related issue is receiving supplies in multiple cases, which may be packed inefficiently and not maximize the use of the space in each box. As a result, you have a lot more corrugate waste to deal with than you would if your case quantities were appropriate. Most facilities don't have the capacity to store this corrugate until disposal. So what's the solution for each challenge? It starts with a greater awareness of what your options are. First, work with your distributor to determine if lower units of measure are available. The goal is to make sure that you're purchasing as closely as possible to what you're actually using. That way, you're lowering your inventory costs while helping to avoid product expirations and overstock. And if you receive a shipment in error, like the urinals, work with your vendor to return the unneeded items. Sometimes even paying a restocking fee is better than sitting on items like that. Next, talk with your distributor about packing more products in every case, especially with custom kits. This should lower the quantity of cases you receive in your shipments and improve efficiency. Plus, it will reduce the amount of corrugate waste that you have on site, which has never been more important. We're all dealing with those recent recommendations from Joint Commission, AORN, and CMS about corrugate in our facilities. So we need to take steps now to reduce the amount of corrugate you have on hand. The next logistical challenge we'll cover relates to delivery schedules and options. Ambulatory centers and surgical hospitals have unique challenges with deliveries that don't affect most acute facilities. Acute facilities are open 24/7 with lots of resources. So let's talk about some questions that can help us better understand this particular challenge. Are your PAR levels based on the frequency of your deliveries, and are they appropriate? Or do you even have PAR levels? For example, if you have 2 deliveries per week, you should have 4 to 5 days of inventory on hand. Now, other factors can affect your PAR levels as well, such as the time of year. We're all busier in the fourth quarter, and we all also are frequently impacted by weather events. So these issues can require higher inventory at certain times of the year. Next, are there physical limitations that make deliveries difficult at your facility? If you don't have a loading dock, for example, your supplies could be exposed to weather when they're being unloaded in a parking lot. And many deliveries are arriving through public elevators and hallways that are shared by other tenants. We also need to make sure our deliveries don't attract the attention from the fire marshal for blocking exits and hallways. Speaking of delivery trucks, many are too large to navigate the parking lots of the shopping malls and high-rise buildings where ambulatory centers are located. Delivery trucks sometimes have to park on the street when they visit you. So if you're having any of these challenges, here's what you can do. Again, work with your distributor to improve the efficiency and reliability of your deliveries. Negotiate with your distributor to ensure that all deliveries are scheduled during your regular hours of operation, to ensure that your deliveries can be made and you're not at risk of any overstock, stockouts, or damaged supplies. There also needs to be someone available at your facility to receive the delivery and move it to a secure location. If delivery trucks have difficulty accessing your facility, work with your distributor to arrive at a solution. For example, can your supplies arrive on a smaller truck that can navigate your parking lot more easily? And are there certain times when the lot is empty for easier access? And don't forget those pick-up, drop-off lockers. That may be an option as well. So now let's move on to a logistical challenge that is common throughout healthcare, using manual processes for inventory management. Using manual processes for controlling inventory is inefficient, prone to human error, and also takes up time that could be better spent on patient care. But for some of you, that's your only option. In addition, manual processes don't generate a steady stream of real-time data that you could use to make more informed purchasing and inventory management decisions. Without reliable data, it's difficult to align inventory levels with actual utilization. So you have to rely on more of your instinct to ensure that you have enough inventory on hand, but not so much that you run the risk of expirations. And if you have excess expiring product, it's usually an indicator of too much inventory on hand. As you consider this challenge at your own facility, ask yourself, are you missing data around product velocity and utilization? And are you using handwritten preference cards, pick lists, legal pads, and charge sheets instead of an automated system? Let's look at some action steps for this challenge. Does your facility have an IT system for materials management? And if it does, is there a preference card module available? If you have a preference card module, you'll want to transfer your handwritten preference card data into your IT system. It's difficult to manage cards manually with practice and product changes, but an IT system is made to deal with the volume and complexity of that data. Once your cards are entered, you'll have real-time data to predict supply velocity, upcoming needs, and cost per procedure. Are you using charge slips for procedures? Your IT system could handle this much more effectively and help ensure that 100% of product usage is captured. With bundled payments, these aren't really charge slips, but they're an excellent method of determining your cost per procedure. Are products available in the OR and materials management system that offer reporting capabilities? Real-time reporting based on reliable data is critical for improving purchasing decisions and inventory management efficiency. And if reports are available, are you using them? Take advantage of your system's reporting functions to improve your ability to control costs. And does your distributor have barcode ordering capabilities that can eliminate some of your manual processes? Or can they even provide reports to help you manage your inventory better? Our sixth and final challenge relates to storing supplies in multiple locations. It's common in the operating room to have supplies scattered in several places. Sometimes it's a matter of space, but sometimes it's just because we've always done it that way. In fact, you might have the same product located in as many as 7 different locations. Some of these locations include your surgical suites, your OR core area, on specialty carts, in your case pick area, they're on your case carts or in your baskets or totes, in your bulk storage area, and then those other non-official stocking locations, such as the nurses' lockers. And do you need to check all of those locations to determine if you need to reorder supplies? Is stock rotated in all of those areas? And do you have issues with expiring product in areas that are not accessed frequently? So what can you do to turn this around? Clearly, stocking the same product in 7 different locations is inefficient. So work toward consolidating these touch point inventory locations so that each product is located in just 1 or 2 places. And I say 2 places simply because sometimes the one place you'd really like to stock the item isn't large enough to store the amount you have to order. Also, you can use specialty or implant carts where available, but resist the temptation to have a cart for everything. That adds complexity to your workflow without adding value. And it's more furniture you have to find a place for. Use specialty carts for those high volume procedures that use a lot of highly specialized supplies. Next, make sure your high use items are closer to the point of use and make those supplies easily accessible for your staff. Conversely, products that are used less frequently can be located further away from the point of use in a more difficult place to access, like those cabinets in our hallways and rooms that are 10 feet off the floor. So those are the 6 major logistical challenges for ambulatory centers today. Addressing these challenges can significantly improve savings, efficiency, and patient safety. But what else can you do to improve performance? There are a few other things I'd like to focus on next. That's improving your inventory management skills, optimizing the use of your facility space, and exploring a few other savings opportunities. So let's start with improving inventory management. What steps can you take today? For starters, you can establish logical par levels based on historical product usage data. Twice a week deliveries can support 4 to 5 days of inventory on hand. Base your days of inventory on hand on actual product utilization and always consider peak days, peak months, lead times, distance from your distributor, as well as weather challenges. There are a lot of factors that go into setting logical inventory levels. Other strategies would include setting min-max levels based on product utilization. Consider the 2-bin Kanban system, where rotating bins help replenish your stock. This works best when your supply resource is a dedicated person, and that doesn't always happen in our world. Make sure you have par levels for all of your areas, not just the OR. Overstock can occur in pre and post-op, in anesthesia, and even the business office. Generating usage reports to align your purchasing patterns with actual product use is a great solution. So let's move on to optimizing your facility space. Earlier in this presentation, we discussed how ambulatory centers typically have the challenge of not having enough storage space. Often, this is due to some efficiencies that you can manage. To begin with, the amount of space you have available directly correlates to how much stuff you're trying to find a place for. Many times, it's not an issue of too little space. It's an issue of too much stuff. So earlier, we saw how obsolete equipment, instruments, and supplies can take up a lot of space that's needed for other items. So get rid of it by selling, loaning, donating, or just discarding it. Setting par levels for all supplies, not just surgical supplies, in your case pick area. One facility was stocking 9 cases of juice in their post-op area so they wouldn't run out. This facility was getting deliveries twice a week. They were located in a major metropolitan city, and they had a convenience store on the ground floor of their building, probably not at risk for running out of juice. So by improving the use of your space on site, you may find that you no longer need to rent additional storage space outside of your facility. Those are dollars you can repurpose to support better patient care or simply take to your bottom line. Here are some more ways you can optimize your facility space. One proven idea deals with the totes you use to store supplies. The trend is to fill to capacity, but what if you don't need to keep all of that inventory on hand? If I have a tote large enough to hold 100 widgets, I really need to make sure that I need to keep that many on hand. Rather than have a large tote that leads to overstock supplies, downsize your totes and storage bins. Then, when you fill them to capacity, you'll still be reducing your inventory and your carrying costs, but you'll have the supplies that you need. Replacing a large tote with 3 stacking bins also allows you to stock 3 items in the space you used to use for 1. Another idea deals with the vacant space above where stock supplies are on your shelves today. Can you stack items to make better use of that vertical space while still ensuring that supplies are easy to access? Stacking bins, lowering shelves, and adding additional shelves can increase available space. And if you're using barcodes to order, make sure you place those barcodes on the bin, not the shelf. That way, if you reorganize and you need to move the bin, the barcode goes with it. Don't waste that valuable vertical space. Clearly, these opportunities are real, and they're not difficult to implement. So now let's turn our attention to better use of our OR cabinets. There's a lot of space inside many of our OR suites, but you need to minimize commodity inventory in these cabinets. This may sound opposite of optimizing your room space, but clearly only store excess commodity items here if space is at a real premium. Use this space for other items. Stock specialty items in dedicated rooms. Free up space in your sterile supply or general storage area by keeping specialty items in specialty spaces. It's closer to the point of use. For example, if you exclusively do eye procedures in one room, store your specialty eye supplies in that room if possible. Rotate your stock. That's a must. If you don't, you run the risk of product expirations, which can impact patient safety. Room stock must be rotated. And can you use those cabinets to stage your case carts? Consider this strategy as one way to streamline your workflow and improve efficiency. This works well if you have a lot of large cabinets in your suites that aren't needed for supplies. Stage your case totes in these cabinets for quick turnover times and to decrease that hallway clutter. A final way to optimize storage space is to implement a comprehensive and efficient custom pack program. Custom procedure packs take up less storage space because they consolidate preference card items into one SKU. Plus, when you add single sterile items that you were previously picking individually, you can further reduce shelf space requirements for those single sterile items. Plus, you can significantly improve OR efficiency by including as many items as possible into a single pack, freeing up clinical time to focus more on patient care. It also frees up inventory management time by giving you fewer SKUs to order on a routine basis. Standardizing the items within a given pack and then standardizing the use of the packs themselves can further reduce storage requirements while improving efficiency. Are there any other ways you can improve your use of inventory space? Walk through your facility looking for unused space. I get excited when I see large areas of open expanse of wall space. This can be a great place to store items. You can create a suture wall with acrylic boxes. You can hang pegboards for instruments or positioning equipment, or you can add additional shelves or cabinets in that area. Make sure your wall is easy to access and that storage does not impede your flow. Open doors and drawers as you go through your facility. You will find some that just need to be cleaned out or reorganized to provide additional storage. And don't forget that vertical space. Do you have a step-down recovery area that's not being used for patient care? Any unutilized or underutilized space can provide valuable storage. Look at creative storage accessories, stacking bins, pigeonhole organizers, pegboards, wall hangers for table accessories. And always remember, although dime store bins may be cheap, they may cost you more in the long run with higher inventory costs. So every day, Cardinal Health helps ambulatory centers and surgical hospitals implement a wide array of strategies to help solve the logistical challenges that we've covered today. So to summarize, reconfigure or modify your physical plant if you can. Make it work for you. Eliminate obsolete equipment, supplies, and instruments. This also includes excess inventory. And get rid of unnecessary supplies before they expire. They're worth more then. Remember, too much stuff creates too little space. So less stuff, more space. Negotiate and maximize units of measure and case quantities. Work with your distributors on delivery options that fit your needs. Automate processes when possible and use available data. And always maximize the space you have. Emma, I'll turn this back over to you now for any questions.
Fantastic. And thank you so much, Marvella, for that wonderful presentation. We will now begin today's question and answer session. And you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. And we will try to get through as many questions as we have time for. Additionally, please do follow the link to the survey that will pop up after you close the webinar today. We greatly appreciate your feedback to help us put on more programs just like today's webinar. So Marvella, we've had a ton of questions come through. The first question that we have here is coming from Kim, who asked, I know we have a lot of equipment and supplies we just don't use anymore because they might be so worth something. How do you recommend getting the buy-in that we will need to get rid of the things that we just don't use?
That's a great question. And what you really need to do is develop a plan. I would pull together all of the instruments, supplies, equipment, anything that you haven't used in the last 6 months, and make a list of those items and what they're worth. And also, put a time amount, like when was the last time this was used. If it's not generating any revenue, it probably needs to go. So once you get all of your items gathered, you've got your financials as to what they might be worth, if you could sell them, then take that information to your decision makers and your stakeholders. Once they see the amount of items that you're keeping on hand that you're not using, that aren't generating revenue, and if they see the benefits of what they might be able to get for those items if they unload them now, is usually a good way to get buy-in from the board, your physicians, and your administrators to get rid of those unneeded supplies.
Great. Thank you so much, Marvella. Let's move on to the next question we have here. It's coming from Justin. He asks, we are currently using one of our ORs for storage, but our activity has increased and we will need to use that OR. Any recommendations on how he may be able to keep from purchasing more space?
That's a great question, and I see that situation frequently. You don't need the OR for procedures, you need it for storage, and pretty soon it becomes your major stocking location. Then when your activity increases, now what do I do with these items? It starts with doing the things that we talked about in reducing your PAR levels, making sure that you're not stocking too many items on hand, getting rid of things that you don't need, maybe moving some equipment that you don't use frequently, but you still need to keep on hand to an alternate storage location, but try to relocate a little bit at a time to other areas so you can free up that room. And start in your general storage room or case pick area. Once you reduce that inventory, you can start moving things out of that additional OR to free up that space.
Great. Thank you so much for those recommendations. And one other question that we have coming in here is from Mandy, who asks, I know we have all of these issues, but it feels like we're always too busy to fix things. How would you recommend finding time to make these changes without taking time away from patient care?
Well, that's another excellent question because none of us have the resources to dedicate to reorganizing our facilities. I just tell folks to use the available time that you have. I don't ever recommend that, you use overtime or have people come in on weekends to clean and reorganize. But if you've got some downtime during the day, maybe it's a day where your cases start a little later, and start with one small area at a time. Don't try to do everything at once. It's that old eating an elephant, one small bite at a time. So start with one small area with whatever time you have, maybe between cases, or if you have one person that's not scrubbing in until later in the day, maybe that person can start working on some cleaning and reorganizing. It's just a matter of maximizing the resources you have and the time that you have available.
Those are great ideas. Thank you for sharing those, Marvella. And it looks like we're just going to take one more question today, but we will be sharing all of the questions that were submitted with Marvella so that we can follow up with you after the webinar. Marvella, so for our last question for today, this is from Casey, who asks, how can I save space using custom packs?
Well, a lot of folks, I frequently hear, I don't have room for custom packs. They're big, they're bulky, they take up too much space. And yes, they can. So you really have to have a plan around implementing custom packs to make sure that you're using your space to the greatest advantage for you. It starts with working with your vendor, whoever your pack vendor is, to make sure you've got your kits configured to the smallest possible footprint. So, basins take up extra space inside kits. Make sure that your kits contain what you need. They don't have items in it that you don't need, and that they're configured and stacked to make as small a footprint as possible. Then, anything that's going into a custom kit, that single sterile inventory needs to be reduced on the shelf. So if you've got 2 or 3 gowns in every one of your custom kits, and your custom kits are going to provide gowns for 80% of your surgery. That's 80% of your monthly gown inventory you can reduce on your shelf. So now instead of having to keep maybe 100 gowns or 50 gowns on the shelf, you only have to keep maybe 20. So make sure that you're reducing the inventory on everything that's going into the kits. Your light handles, your suction tubings, any basins, drapes, anything that's going into the kit, your inventory is going to go down on the shelf. It's not going to go away completely, but it's going to be greatly reduced. As you reduce that inventory on the shelf, reduce your totes, your bin sizes to a logical size for that lowered inventory, and that gives you room to store your custom packs.
Wonderful. Well, Marvella, that is all the time that we have today. So I do want to thank you for your excellent presentation. A thank you to Cardinal Health for sponsoring today's webinar. And last but not least, our audience for listening in today. We hope you enjoy the rest of your day, and we look forward to having you join us for future webinars.